Hi there, my name is Nicole. I am a senior medical resident in internal medicine at the University of Ottawa, and the Competency by Design team has asked me to provide you with a few tips and tricks from an assessor's perspective about how to be successful with the CBD curriculum and completing EPAs. I would say there are probably three main things that came to mind when I was thinking about this. And number one, I think really importantly, is that you touch base with your senior residents, your staff, or whoever might be evaluating you at the beginning of a block, or even if you want to be really proactive on a weekly basis about what learning opportunities you're seeking and what EPAs you really need to prioritize for that particular rotation. This in turn helps me as a resident or staff who hopefully are invested in your learning as a junior to seek out those opportunities for you or alongside you. I think it goes a long way to have two people seeking those opportunities for you rather than just yourself. Staff and more senior residents often have a lot more resources at their disposal for facilitating those opportunities for you. And I think it will go a long way to help you complete EPAs and find opportunities that you might otherwise not have done or not have found. The second thing I think is quite important is to request and actively seek out direct observation from your staff and your senior residents. Direct observation is going to lead to a situation where you receive a lot more valuable feedback from your assessors, and you'll find that assessors are far more comfortable filling out more EPAs for you if they've directly observed you doing a bunch of assessments or clinical procedures or patient encounters in general. And the feedback in that setting, again, will be a lot more valuable because they can provide specific examples. They can, actually provide you probably with more compliments about what you did well, and they can, in addition, provide you with examples or suggestions for improvement that are a lot more, personalized than they would have been otherwise. It's really difficult to do assessments for trainees based on indirect observation in general. So I think facilitating direct observation as much as possible when there's time is important for your feedback. And then the last thing I would say is the timing of getting these EPAs done is really important. It's really daunting and mentally stressful for an assessor or a staff at the end of a week or the end of a block to receive a pile of 4 or 5 EPAs or more even that they have to complete for a particular trainee. They're a lot less likely to sit down with you to complete those EPAs. I think there's a lot higher of a chance that those EPAs get delayed by a few days, a few weeks even, and that as a resident you end up having to email to request that those EPAs get completed. And then real-time EPAs, again, going back to valuable feedback, allow the feedback to be a lot more directed and a lot more specific and a lot more helpful to you just as an individual resident for your learning and for your improvement. And I think it's easier on everybody if you get those EPAs done sort of either right after a clinical encounter, at the end of the day, or even the next day. And you'll find, I think, a lot of assessors will be more willing to do your evaluations more frequently in that perspective, as long as things don't build up for them at the end of a week, as I was saying before.